Hello, this is Dr. Rich Blake, and I'm here discussing bunions and the evaluation of bunions. It's a very common surgical procedure that podiatrists do. It typically, in our practice, when you're between 70 and 75, that's really the surgical time when you want your feet to be in good shape throughout your later years. But before that, a lot of patients are able to avoid surgery by using simple treatments like yoga toes, toe separators, orthotics, etc. I have a lot of other YouTube videos discussing some of the treatments. Today we're going to talk about bunions and how to evaluate them. The number one reason somebody who has a bunion comes into the office is not so much from the looks, but they begin, as the bunion moves over, begin to have a problem with the second toe. And most of the pain is in the second joint. And therefore, the bunion needs to be worked on to take the pressure off the second joint. The number two reason people have bunion surgery is because they're developing arthritis in the joint. They may have a bunion, but the true problem is arthritis in the joint. They start having a limitation of motion within that joint, and the joint hurts deep within. Sometimes people have bunions and they develop sesamoid fractures or some other problem. So just because you see a bunion, the evaluation has to be with x-rays, sometimes MRIs, and a very thorough discussion of what is actually causing your pain. And the third reason people need bunion surgery is just that the bump gets too big. Stage 1 bunion deformity is where you start to notice a bump. Stage 2, the toe starts to come over, and when we load the foot, if there's no separation between the toes, then that's stage 3. Stage 3 is actually when the bunion gets worse, as the big toe cannot push over anymore. It actually, ground reactive force pushes the bunion outward, and the bunion gets worse. And then stage 4 is when there's a destabilization of the second joint, and then the bunion has free rein to go wherever it wants to, and it starts to usually drift under the second toe and cause havoc with the whole alignment of the leg. So when I'm discussing bunions with patients, I'm asking them, where does it hurt? Does it hurt on the bump? Does it hurt deep within the joint? Does it hurt at the top, the bottom? Does it hurt more towards the second toe and the second joint? That's a very important clue to what's going on. Then I look at the range of motion. The range of motion should be very smooth, as in Pat here, just very, very smooth. I should be able to evaluate the joint range of motion and find that the patient easily gets to about 75 degrees or more. When that happens, there's no arthritis usually that's developing in there. If the joint motion is less than 60 degrees, there may be some sort of arthritis, and sometimes it's called hallux rigidus, where it's less than 30 degrees. So that measurement is very important to joint. Then you palpate the joint, see if you can elicit where the pain is. If the bunion's moving over, a lot of times you get an impingement on the corner here, and the pain is primarily not at the bump, but at the side. And those people really love toe separators. You get the medium gel toe separators, you start them using yoga toes, maybe some physical therapy to stretch things out. Definitely podiatrists tend to get x-rays to look and make sure there's no bone spur or whatever. So the range of motion is important. Where the pain is. If the pain is all on the bottom, it may be a sesamoid problem. It's bunion pain usually never hurts on the bottom. It can hurt on the top because of a bone spur starting to develop, but it should never hurt on the bottom. And then evaluation of the second joint becomes crucial. If that's where the pain is, you want to work the range of motion, see if the pain can be elicited by range of motion. And then you also want to stabilize the metatarsal and pull the joint up and down to see if it comes out. Somebody who has a plantar plate injury, they can dislocate or sublux off the joint dorsally. Here Pat demonstrates just real solid integrity of that joint. So where the pain is, what the range of motion is, and then you can also test the strength of the tissue. You can, Pat, push against my hand, and you have her push up to see if there's any problem. If you have an L4 nerve root problem, that can give you weakness, and you have them push down and see if that produces pain. So sometimes the pain can be tendonitis in the area. So I hope this helps briefly in discussing when you have a bunion and you have pain in the area, to look a little deeper and make sure that it's not related to another problem, and start some conservative treatments to try to avoid needing surgery. Okay, thank you very much.